You can see you.
Hello?
You can see you. Go ahead.
Okay.
Yes, Mr. See you.
Okay. So thank you so much for having me and for having this discussion, especially in times like this. And of course, congratulations to innovators who have taken the pandemic by the horns and decided to come up with innovations that will help us come out of it, in one piece. And so I will not spend much time so that I think towards the end there's more time for discussions and questions. But I would like to just start off with a few facts. Number one is we have seen the way the pandemic spreads. One infected person could infect 2.6 people, according to the data from the World Health Organization. And after 10 generations of transmission, the 2.6 will have spread to 3,500 people. And that's why you're seeing some countries with ridiculous numbers. Israel last week was having about 7,000, positive cases per day, and took them back to a lockdown. And we saw the significant increase that was in Wuhan when China decided to do a total lockdown. And of course, there's a few other examples, Italy, the US, and the likes. Now, this is enough evidence for us to take this virus serious, because with an increasing number of cases comes a large number of deaths as well. Of course, it varies across different continents and countries, but the virus, behaves differently according to the host that it's in. And so this is, of course, a lot of need for us to be cautious and take measures in very seriously. And so when you look at since the pandemic, of course, I commend our country and a few other countries that have done so much to curb the virus. But we came from a lockdown, total lockdown, with everything closed, most businesses completely shut down, and of course, the economy can only take it for so long, and so we had to then open up. And so if you open up, the virus is still not gone, and the stakes are still high. Of course, we understand it much differently. We had to give us time to be able to flatten the curve, manufacture masks, get enough hand sanitizers, and put in place measures that can stop the spread of the virus. But of course, this is not enough, and that's why some countries are going back into lockdowns. And so it then also adds, calls for us to create innovations that will help us go over and above fighting across with the measures of washing hands, wearing masks, and the likes. And so some of the measures in innovations that have helped a lot have been contact tracing, which Singapore and Hong Kong have done very well, and I think Rwanda to a certain extent. But a lot more needs to be done, especially when people are now going to restaurants and hotels. And following up positive cases strictly could help us avoid reducing the curfew hours, getting back into lockdown, and a few other draconian methods that have been used to protect us as citizens. And effective contact tracing, of course, has two sides to it. And it has caused a lot of debate around, data privacy and is it invading people's rights? But the honest truth is the balance between human rights and public safety is always changing. A very vivid example is after 9/11. After 9/11, we had airports take draconian methods in checking and screening of people. And this is because people were okay with it, because they were willing to trade their safety for a little extra. They were willing to trade their privacy for a little extra safety. And I think this is the times that we're in as well with this pandemic. If there can be some strong measures that are taken by innovators in protecting people's data, which I think DIT, that is a host of this conversation, will be talking about, then people should see this more as a civic duty to protect our country, our neighbors, our parents, the vulnerable people, and most importantly, the frontline workers like the doctors, nurses, RBC workers, the police, and people like that who do not have the option of staying home, social distancing, and things like that. And so it defeats the purpose when someone puts their privacy ahead of public health. The fact that if you're infected, of course, for people who are a lot younger and do not have diseases like diabetes and the likes, they're taking this slightly lightly. But you could easily transmit that to your grandparents, to your parents, to an infected person, and that could not go as easy as it is on the younger generation. And so we need to be very cautious about things like this, and of course, take contact tracing not as a burden on us, but as a duty in a certain way. And of course, that comes with also innovators being having the responsibility to use people's data very well, passing it on to the right institutions, not monetizing it without the right permission from the owners. And I think the government has released the data privacy law, which I think innovators should also be very cautious to ensure that they're following. And generally, everyone having the collective responsibility to say that we are going to be with this virus for probably the next 8 to 12 months. And it's less about what has happened or what caused it or how much is being done, and more about what can be done to get us, out of this in one piece with as little as with little damage in terms of loss of lives, economic losses, and the likes. And so I will just hold from there in saying that we need to be very serious and deliberate about contact tracing. We need to be very deliberate about protecting the data of people, and there's enough guidelines, I think, to show how that can be done. And there needs to be some collective responsibility between decision makers, and that is from the policy side, and then of course the policy takers, which is the citizens ourselves, in ensuring that even when contact tracing is being done, we also feel the need to ensure that we're giving the right phone number, we're giving the right ID, and not going around, trying to falsify where we've been and the likes, and seeing this as an infringement on our privacy, but rather there to protect us. Thank you.
Thank you, Patrick. Patrick has made it very clear. We need to be very deliberate in protecting people's data despite the pandemic. Our next panelist today is going to be Ms. Mutoni. Ms. Mutoni is the Managing Director of DIT Services. Her company is the brain behind Ikaze App. That I'm sure she will talk about during the webinar. Welcome on board, Mutoni.
Thank you so much, Brian. Hello, everyone. Good morning. Yes, my name is Mutoni Daphne. I'm the Managing Director of DIT Services. I can give a brief introduction about who DIT really is. DIT is a company that drives innovative and cutting-edge digital solutions that impact and benefit all communities. So at DIT, we believe that a smart world is a safe world. So we provide solutions to businesses and organizations. So we that work in both the public and the private sectors, which we believe in turn will provide employment opportunities. So that was just a brief introduction of what Ikaze is, what DIT is. So we'll talk about what our application is all about. The name of the application and the system is called Ikaze. We named it so that it could relate more to the people of Rwanda because it's a made in Rwanda product. Ikaze is a B2B software suited for corporate and public service entities. For example, restaurants, hospitals, offices, restaurants, and security companies. So basically, Ikaze application is meant for business owners, organizations, not for the whole public. So Ikaze briefly is a visitor and employee management system. We developed it based on the idea of eradicating pen and paper. So we wanted to digitize each and everything that people were registering in. So with Ikaze, we have two types of Ikaze. We have Ikaze Basic and Ikaze Plus. So with Ikaze Basic, just registers visitors. And with Ikaze Plus, it's both employee management and visitor management. So this system is much wider, and we shall see in the video after my brief introduction. So we realize that one of the top problems around the world is inadequacy of information to trace people. So we realize that pen and paper during the registration is unhygienic. We break the law of data privacy, and there's possible falsification of people's information entering different premises. So with that, we realized we needed to develop a digital tool to help register people and so that people could feel safe. So with Ikaze, we have one that is phone-based, which is Ikaze Plus, Ikaze Basic, and one that is computer-based, which is Ikaze Plus. So with a phone-based system, it's sort of an app. You can go download it on Play Store. It is called Ikaze. So this phone is given to a security guard or a receptionist, the one in charge of registering people at every entrance of the premise. So with Ikaze Basic, you are given the app, and so the security guard can record either your ID number or your phone number. So what Ikaze does, it is connected to the NIDA servers, and these are the ID servers. So it's connected to the NIDA servers and the telecommunication houses in Rwanda. That is MTN. So with that, our visitors can easily register their information and believe that their data is private. So basically, Ikaze is also user-friendly. It is hygienic because our visitors are not forced to actually write their names in the books, and then we actually get actual data and accurate data for these visitors that are entering these premises. So it is easier for institutions such as RBC that are in charge of contact tracing to come to this institution or this premise and ask for information of a suspect and receive it and retrieve it. So we realized that with the pen and paper, people were collecting a lot of data, and it was very hard to understand who was sick and who was here at a certain time. So with Ikaze, it's very accurate and the data is private. And with also, so we believe that Ikaze, it's easier for people to use. It is not difficult, and Ikaze also presents to be like a post-COVID system. So Ikaze is not generally meant for only COVID, but we know that as we go on, we shall get used to even these digital tools. So thank you very much, Brian.
Thank you for that short presentation, Tony. Like we said before, we need to ask you a few questions about your app. So, what do you think is the greatest contribution of your app in the fight against COVID-19 today?
So we believe that with Ikaze, number one is all these premises are able to comply with government directives of registering people in a smart, fast, and safe manner. So we know that there is no spread of COVID-19 because the system is touchless. And we also believe that the pen and paper-based visitor log is not secure. There is false information, even thus making it difficult to trace suspected COVID patients. So we believe that ICAZE were able to retrieve all this data in an easier and safer manner. And also ICAZE enables institutions such as RBC direct access to trace all contacts through the servers without initially relocating to the premises where the cases were identified. So if RBC says there is a suspected COVID patient that was found in a restaurant A, they don't have to necessarily close that restaurant. They can come to DIT and ask for this information and say restaurant A was found with a suspected patient at this specific time and day, and we can collect that data. So initially, we know that ICAZE, there is no need for you to actually close down the restaurant, but rather you can just close down maybe for just a day or two, but not necessarily closing down the business. So that is how fast the institutions are able to receive that information. So also ICAZE as a contact tracer helps streamline data flow and data management by improving timelines of and monitoring the dashboard. So with ICAZE, we make sure we give every restaurant owner, hotel owner, or organization a dashboard where they can analyze the visitors that are coming in and out of their premise. So it is much easier. And we know that ICAZE can be upgraded to the features that the public health personnel require. So we know for sure that it is easier to fight COVID-19 in that way. Thank you. Thank you, Brian.
Thank you, Mutoni. With us today, we also have Dr. Jaya. Dr. Jaya is a medical doctor and journalist. Jaya works with Internews and she's a pandemic media mentor. Dr. Jaya will talk about the role of ICT and other digital tools in contact tracing, and she also give us a brief presentation. Welcome, Dr. Jaya.
Thank you. Thank you very much, Mr. Kimeni, and also to Christoph, who's organized this wonderful meeting on a very, very timely subject at this time. I realize that there may be many journalists who are not very, clued into contact tracing as a public health concept. So I'd just like to spend a couple of minutes talking about what we mean by contact tracing in public health. So approach when you want to control the spread of an infectious epidemic disease, and I think COVID-19 is a case in point where we've seen a huge global pandemic spread at a rapid pace, affecting a lot of people. 2 months this year. So contact tracing essentially is a public health strategy that seeks to break this chain of human to human transmission. And essentially it does this by identifying the people who are exposed to the confirmed cases and then quarantining them. And then you follow up with them to ensure that they are, follow-up tested and then treated in case they develop symptoms. So if all of these actions of contact tracing are done well, in a systematic and effective way, then we can ensure that the number of new cases that are going to be infected by every confirmed case is maintained below 1. And then that's how we eventually slow down the spread of COVID-19 or any infectious disease. So in the context of COVID-19, we know that the incubation period is somewhere between about, up to 14 days. So the contact tracing aspect will have to operate in that time period. So you try to identify someone who's been exposed to COVID-19 and you follow them up daily for about 14 days from the point of exposure to see if they fall sick, develop symptoms, or they test positive. But because this transmission can occur to other people before the symptoms develop, we have to ensure that the contacts stay in self-quarantine during that 14-day monitoring period so that they don't expose others. Now, what's all the excitement about the digital, sort of response to COVID-19? Yes, as public health people, we are all very excited because traditionally we've had a lot of difficulties with pen and paper solutions. You'll have to work with already several systemic challenges. Like we never used to be able to completely identify the contacts, and then it's quite a complex data management system if you're all going to do it on paper. And then there'll be several delays in the identification of contacts, to isolation, and then to track the suspected cases. So everyone's excited about this also because in recent times the contact tracing performance for Ebola virus in the DRC has shown how effectively a digital contact tracing approach can actually work. So just to sort of go on to say that in traditionally speaking, contact tracing, you can apply it, utilize it in three major ways. And, this is classic WHO approach. One is the outbreak responses. The second thing is for, proximity tracing. And the third way is for symptom tracking. And I'll ask, that's a circle of the many ways in which one can actually apply digital tools, and you'll see contact tracing is just one part of it, right? So next slide, please, Christoph. Next slide, please. Yeah. So these are the main ways, and the next slide, please. Next slide, please. If you look at the outbreak response is mainly used by doctors and public health officials. So that, as a public health strategy on a large scale, we can look at all aspects of case investigation, listing out the cases, monitoring the contacts, and then going ahead to analyze all of this and monitor our own performance as we try to complete the contact tracing process and ensure that people are protected. But because these contacts are linked to several cases, several other people as they move out into the community, and then the people that they come into, the contacts come into contact with, I mean, this is a sort of a very, very challenging, dynamic, ongoing process which has to be managed over a long period of time. Next slide, please. Next slide, please. Yeah, so proximity tracing is something I think that my earlier distinguished co-panelists were talking about. Essentially, proximity tracing, where you try to find out someone in the, close to you within a certain short distance, usually less than a meter, because that's when you get most exposed to aerosolized infection, from somebody coughing or sneezing or singing or something. That is proximity tracing, and this is what a lot of the GPS and the Bluetooth based technology that these phone apps are using, including the one from India, which I'll share with you in a minute. I mean, this is the popular notion of contact tracing. I just put in those little bits of information about outbreak response, and I'll tell you something about symptom tracking, just to show you that contact tracing is actually a slightly larger scope of operations. So if you look at, proximity tracing, I mean, this is the really sticky and tricky area, if I could call it that. And, the main point here is proximity tracing will work best when you have a community where there are several cases of SARS-CoV-2 infected people, so that the chances of one person being exposed to someone else with an infection is much greater. So in a densely packed population where, within 1 meter of you, within 2 meters of you, there's lots of people with it, then this proximity tracer on your phone app, it can be zinging and, sort of beeping, and, that's when it really works well. Not in those communities which are, where the population is sparse and, the chances of picking up people in your proximity who might be infected, well, that chance is far less. So, so you need to sort of think about these things for the app. And another major aspect that my co-panelists touched upon was, of course, the privacy issue. And I'll share with you in a minute what happened, in India with our own app that the Prime Minister was trying to popularize on a large scale. So the third major, next slide, please. The third major way in which contact tracing may be implemented through digital tools. Next slide, please. Yeah. So here is when someone who could be ill with symptoms of COVID-19, they can track their own symptoms using the phone app, and then getting in touch with the local doctor or a care provider, through contact given on the app. Like, let's say I have a cough and a fever, then I understand these are symptoms of a SARS-CoV-2 infection, and then I press a button on the app, I choose a certain option, and I immediately can get connected to a healthcare provider. So this is particularly useful for people, where healthcare providers can't access them, where there are certain physical barriers or something like a hard to access area, or they're not able to sort of come out of their, stigma is a huge issue here. So if you want some advice about care and you're not allowed to go out of your house, particularly for women in my country, then this could really help, the Symptom Tracker. Of course, the danger is always that, anxiety and panic, if you misdiagnose your own symptoms and you sort of exaggerate your own symptoms. And the attendant risk is, of course, self-medication, where you might find, you might think you have a SARS-CoV-2 infection and start treating it yourself with all kinds of medication. So I just wanted to sort of, finish up this little public health section with one very important message, which is that digital tools can never ever replace the human element, and contact tracing through the classic, health workers and the medical doctors and the support staff. I mean, they are needed at every stage, and digital solutions are not a standalone solution. Next slide, please, Christoph. Thank you so much for helping me out with the slides here. Next slide, please. I just wanted to share with you, a little bit about this Arogya Sethu. It's a Hindi word, and, Arogya means health, and Sethu means bridge. So this is a very cute name, like a bridge to health, because it reminds you of all the little linkages you see on your, contact tracing apps, bridging people to health services. But that was the idea. Next slide, please. Next slide, please. Yeah. So I just wanted to, of course, India's digital, we have a very glamorous image in the world as being a digital and a tech giant. And of course, anything we do seems to be big because our numbers are massive. We have about over 1 billion population, 1.2, and the number of smartphone users in India actually is going up. I just marked out the bar, to denote the year we are in now. That's 2020, the year of when COVID took over the world, if you like. And there you can see that we have about 696 million smartphone users in India. So that's, over half the population. So it's a very, very good penetration. Although we might think, what about the other half? Just to remember that even half the population refers to millions and millions of people. Next slide, please. Next slide, please, Christoph. Yeah. So this Arogya Sethu, or the Health Bridge app, in April this year, soon after the Modi government launched it, it was among the top 10 most downloaded apps in the country, and close competition to all these familiar names that we know: Zoom, TikTok, Facebook, WhatsApp, Instagram, Messenger. Only these were the competition. These were the apps that overtook it. These social media platforms that overtook it. And by mid-July, we had about 12.7 million downloads. And then now, as of mid-September, we have about 150 million people on the app. So if you look at, but if you actually look at, if you remember what I said about proximity tracing, you need to have a very high number of infections concentrated in a community for proximity tracing to really work. And if you look at our population of over 1.2 billion, 1.3 billion, the probability, what are the odds of coming across somebody with COVID-19 infection generally across all communities? So the app is probably going to be most useful in very crowded metros and very crowded urban areas within the metros and the larger towns and cities. So I'm going to request Christoph if you would be good enough to just play that YouTube video, and we can stop it after the first 5 minutes, I think, so that just to give everyone an idea of what this app is all about. Thanks, Christoph. Christoph, can you play the video for me?
Yes, please. Yes.
Thank you. There's been a lot of hope around this video because we're always excited at the thought of a simple, push a couple of buttons and you solve all the public health problems, but we're finding out that it's harder than we think. So I think we're in a stage of euphoria right now about Arogya Sethu and all of these digital tools that are becoming available. But I'll show you in a few slides after we see the video what's happening. It's taking a while to load, but almost there. Christoph, I'm going to quickly see if I can play it from my computer and share it. Just quickly looking at that. Just give me a minute.
Statement made by the Ministry of Electronics and IT, the app tracked the user's interaction. On April 2nd, Narendra Modi government launched the Arogya Sethu app that gauges whether people are at risk of contracting coronavirus. According to a statement made by the Ministry of Electronics and IT, the app tracks the user's interaction with others in a bid to inform them as well as the authorities when they come in contact with a coronavirus positive patient or when they are deemed at high risk. As the app uses Bluetooth or the GPS proximity of a user's phone, the makers of this app recommend that the user switch on the location and Bluetooth settings at all times. Let's break down how this app works.
Turn up the volume a bit, please.
On Tuesday, roughly 42 million people across India downloaded the app made by the Indian government and volunteer tech developers.
Excuse me?
Arogya Sethu.
Yeah.
This
Could you
app
turn up the
is
volume, please?
Yeah. Determine whether
Okay.
they come into contact with any high risk or COVID-19 positive patients. It will also help the government determine if there are any hotspots that need to be treated differently across the country. It all started last Tuesday when there was a meeting between the Prime Minister, other high-level ministers, and the tech developers when they were presented with a presentation about how this app would work. Since then, there's been a huge push amongst the highest levels of government. You have the PM tweeting it and discussing it in his speeches. You have high-level ministers tweeting about it. The HRD ministry, the railways ministry have been sending out advisories to get students, employees, and teachers to be on the app. You even have banks that have been telling their account holders to download the app. Partly, one of the reasons that there's been such a push, that this app is mostly effective if and only if enough of people across the country download it, the so-called critical mass. If the app works is that if a user downloads it, the first step is a registration process in which a self-assessment asks the users questions such as age, profession, if you're a healthcare worker or a delivery worker, any pre-existing conditions you might have, such as hypertension, lung disease, any international travel history you might have, as well as any potential contact you might have made with a COVID-19 positive case. When that self-assessment is completed, the app then presents a risk score. For example, your infection risk might be low, which means you might just have to stay indoors during the lockdown period. If you ever come in contact with someone who is high risk or COVID-19 positive, then the app will send you an alert. Now, how the app works, how it collects data and where it stores data, is that when you are registering, it sends your location and any other information that you've included to a server. The server, as of now, is an Amazon Web Services provider. It later will be transferred to your government National Informatics Center. Now, after registration, the only other time the data is sent from your phone to the server is when you A, are determined to be high risk, or B, if you end up being tested positive for COVID-19. All other times, this app is only collecting and storing the data on your phone. This data includes your location every 30 minutes, as well as your Bluetooth data. For example, if I'm carrying this phone around, another user also has downloaded this app. The Bluetooth data, it recognizes that these two apps are in contact with each other. That log history stays on your phone, as I said, until either one of these people determines to be higher risk or COVID-19 positive. At-risk decisions being made after you take the self-assessment. As of now, it's algorithmically based, but the tech developers are hoping that they will add a human level to this decision making. They're also attempting to add new features, including an integration with the e-pass system, which would mean that if you have a clearance to have an e-pass, it might double check with this app to see if you are high risk and if you should be allowed that clearance. Developers and the government officials have told me that if the algorithm has decided that anybody is higher risk, now the next steps would be determined by the appropriate health authorities, whether or not that requires being tested, whether or not that requires having a quarantine check. All of those decisions are being made by medical authorities, not by the tech developers.
So
downloads the app after they've been determined positive, where would their locations, where did they come from? And I've received somewhat mixed answers, but overall it seems like there is an application programming interface, which is an API, a highway between two different databases or programs.
I think stop here, Christoph. Thanks.
To the Indian Council Research. Now that would help them integrate databases.
Can we go back to my presentation, please? Yeah, this was also to just share with you how a mainstream media, newspapers, sort of trying to explain what this contact tracing app, means and breaking it down for the public. So this was like a new media product, which I thought I would share, because I know many journalists are tuned into this program. So it's just something like a bit of explanatory journalism, if you like, that tries to break it down for the lay public. So the next slide, please. Yeah, I mean, I just say, this Arogya Sethu app, no matter that very pretty sort of, icon with a heart and a tick mark and all that has run into a lot of heartache. Can you make it a slideshow so that that little small letters can be seen, Christoph? Thank you. So it's going to be a long and winding road ahead for this app, because there are several kinds of concerns coming up from civil society organizations and communities. And so we're seeing a strong sort of societal pushback. And what happened was, after the initial rush to sort of download the app, which happened, by the way, because of a government directive, which was like an order. It said that every government employee had to download the app. It was made mandatory. And because of the panic that was, very prevalent in the country during April and May, when the lockdowns were, being enforced in a very, very brutal way with, police beatings in public, and a lot of fear was at its height. It was also made mandatory for private sector employees to ensure that, private sector owners, employers, to ensure that all their employees downloaded the app. So this was made mandatory, and it sort of went along for a while till the public interest litigation started coming in. The first one was from Kerala, home to the first, democratically elected communist government to the world. Of course, we don't have that system there anymore. Still, on May 11th, there was a public interest litigation, and the Kerala High Court took a note of it and put it out online that there was an objection that the government can't really make this mandatory. It would be an invasion of privacy. And then a couple of days later, we had the former Supreme Court Justice, who was the chairperson of the Data Protection Bill, which is yet to be tabled in the Indian Parliament. He came out with a screaming headline saying that the order that every person has to download this app is utterly illegal, quote unquote, and that really, if the government wanted to enforce the mandate, it had to have some parliamentary legislation to give it teeth. It didn't have that power. What was the order was actually, came out of an interdepartmental circular, and it couldn't really be enforced in public. And so after that, the government sort of toned down the language in its advisory and said, everyone is advised. We advise all individuals in the country to install the app. Next slide, please. So just to show you exactly what the social pushback is all about. Next slide, please, Christoph. So the first, this is it in a slide. So to what extent are individual rights and freedoms being compromised for the greater public good, and are we justified in doing that? Should we be trying to enforce a state of public health emergency, as it were? And we can look at the specific objections. Next slide, please. So the first one is, you have the Arogya Sethu app collecting people's GPS trails. Essentially, this is something that the WHO has flagged up as a concern, and any democratic country in the world would flag up as a concern. So essentially, people don't want their movements to be tracked. That's a major concern. And the second major concern is that it's trying to use, a centralized social graph analysis and mapping interactions between individuals, so who you're meeting. And, that is something which we really, the government would love to do that, but that's getting a very strong pushback, as it should. And also it uses a kind of a device which can help the government find out who you are. Even though you're coded, it can come back and re-identify you and find out your name and, all the other personal details about you. Next slide, please. And, all of the data that you sort of upload about your symptoms or your address or your profession or, your health details, such as I have hypertension or diabetes or anxiety or depression or anything like that, all of those personal details that we enter into this Arogya Sethu app are taken into a government-operated server, which is interfaced with other government-operated servers, and so the information is shared between government departments. And of course, there's always the fear that some of this information will be leaked to third parties, insurance companies, for instance, marketing companies, for instance. So there's also public health concerns, like, you can get false positives and negatives and create unnecessary anxiety. And so I think I'll just end here and just a couple, can you go to the last slide, Christoph? Don't want to take too much time. Very last slide. Yeah, so just to say that it's not the panacea that it's claiming to be, at least not at the present time, until we iron out all these technological wrinkles, which are essentially, we need more evidence that digital tools are a great way to contact, trace, with all of the technological wrinkles ironed out, such as you should be able to ensure privacy, you should be able to address concerns about data sharing. We have to ensure that the way we are, all the information about this app is made transparent, transparently known to us so that we can make an informed decision about this. And I think, again, I'll end with a very important public health message, which is that a digital tool can never replace the public health, personnel. This needs to be complementary to the regular, huge traditional public health approach with people on the ground who actually are out there doing the job. And these are more like job aids. So thank you so much. I'm sorry if I exceeded my time.
Thank you so much, Dr. Jaya, for all the details you've given us about Sethu App. Next, with us, we have Dr. Vincent Mutabazi. Dr. Vincent has over a decade of experience in medicine. He's currently working with the COVID-19 task force, and we're happy to have you, Doctor. The first question, Doctor, what should be done by the tech world to help doctors like you in the field, in the fight against COVID-19? Doctor?
So thank you, Kimenyi. Good afternoon, everyone. I'm speaking from the field. I hope the technology that we are talking about does not fail me. So I would like to start by thanking the other speakers. And just to set the stage for the COVID-19 pandemic, categorize the response in 5 pillars. So we have laboratory science. Related to that, we have infection prevention, we have science, and then we have surveillance and epidemiology. So for the purpose of discussion, supporting the work that we do. So what is surveillance we're doing out in the field as we try to respond to, especially with regard to its vaccine at this point or therapy. So surveillance beat of COVID-19.
Doctor, your internet is a big issue.
In terms of the containment and mitigation of COVID-19. So in its setup is it's systematic, it's ongoing, it's an interpretation of to allow us to provide evidence-based that in scale data and data management is quite, and we need, as we have already done anyway, to adopt digital technology in the planning, in surveillance, in testing, in contact tracing, in quarantine care, and in other areas. So digital health technologies can really facilitate us in the field in terms of in ways that other responses or the manual kind of response might be a little bit difficult. A previous speaker has talked about the pen and paper and how that data, how it's manipulated, its accuracy, its completeness. So that might be quite a challenge. So Rwanda has already from the very beginning, it's really a tech-savvy country. So we have already integrated a lot of digital technology in the effort to contain the pandemic from the very beginning. So I like this discussion, and of course, the ICAS application is a very welcome addition to the tools and initiatives that are available for us workers in the field. So it's a very exciting to, of course, have this discussion, but of course, have those technologies that are available to us in the field. I think the question from the moderator, how has the tech world helped not only the doctors, but the health care sphere that is really has different facets of doctors and community healthcare workers, social workers, administration, logistics. So it's really a combined effort that goes beyond the doctor and his stethoscope, but encompasses a bracket that has so many different people roles. So I think COVID as a pandemic actually spurred the switch to emerging technologies, or those that have been existing, that have just been tweaked a little bit to help to lighten the workload for the response. When I say the response, it's probably just beyond just the healthcare sphere, but to, of course, the other components that are involved in the response. I think a good place to start would be, even what we are doing now, the video conferencing, to get the message out, but of course, allow that to be done in a very safe way. The reduction of risk that allows the avoidance of close-up interaction that to coronavirus exposure. So maybe beyond that, just bring it closer to home. I think many people have already seen and heard that using robots as part of our technological support in the Rwanda healthcare setting, and in particular the COVID-19 response, where these robots have been used in the distribution of drugs, food, disinfection, also patient assessment, vital sign, and other functions. Technology has also been important in telemedicine. Now we are moving towards a strategy that we are calling a home-based care, where our symptomatic patients are now from home. So telemedicine is quite important. We are having a follow-up of patients in home confinement, where we are able to interact with the patients, have either online health consultation to providers from the comfort of their homes. I think one of the important is the app is something that can be in an important community, is really something that we in relation to data capture, analysis, and data management in a certain extent. So much data going around, so artificial intelligence up. It's in detail and reporting health. So we have actually seen the use of from that treatments for our COVID-19 patients, and of course, we are excited. My technological for us moving forward. Move to allow quickly and in a timely way annihilate identification and so on. So technology is
Thank you, Dr. Vincent, for the explanations you've given us. With us today, we also have Moses. Moses is the brain behind Ikaze app. Moses, are you there?
Yeah.
Moses, would like you to explain how Ikaze VMS is a solution to contact tracing, especially putting in consideration Dr. Jaya's presentation about proximity issues and data storage.
All right. Thank you all for inviting me. About the Ikaze, let me start by answering the question of how it will help in contact tracing. Ikaze, compared to what the Jaya has presented on the app from India, I think it's a bit different from ours. Although we can maybe integrate all those options, so far what it does is that it is placed on the entrance of every building. So we will have operators working on it. An operator will have an account. He'll be able to register anyone who is coming in. So it will be easy to use the phone number, to use the ID number, or to scan the barcode of the ID. So how it does, it registers in and out the entries and exits of the visitors, so that we'll be able to track whoever comes to the building. Let's say if someone entered in RDB and was tested positive, so it will be very easy to see in the system and see this guy came to RDB on this time, date, and then we'll be able to see all the visitors that were there. If we can use it around all the buildings, it will be very easy, because whoever gets out will have to enter in a building somewhere else. So in using that Ikaze, it will be very easy to locate, to know who this person was and who made this person. So about the storage and the privacy, let's say on the storage, we don't allow all users to download the app. That means we don't we did not suggest that everyone who has a smartphone will download this app. What we'll do, we only give it to the few people who will be using this, because before you download, you have to enter the server address, and the server address, after entering it, you create the account. So we have to approve in the system whoever is going to use it. So we did not suggest that everyone will download the app, because sometimes it brings a problem to the security issues. But maybe if that would be the case, that would be another issue to see. But if you download the app, whoever can download it, but you cannot use it. So you have to register and you have to approve. And about the privacy, if someone can hack it or what, so that is another issue. But we have a very good answer for that, because even the NID to give us the API so that you can access their information, it's another thing that they had to verify our security measures. So we have security testers who are working on ICAZ every day to see that no one can breach the security. So about the ICAZ Plus and ICAZ Basic, ICAZ Basic uses the mobile phone, and ICAZ Plus is a desktop version. So what we do on ICAZ Plus, it has so many options. We can even we can even register by office. So that means if you enter into, let's say, telecom house, we can register you by the entrance, but when you go to the office, also there's an option to register the office you're going to. So it has the detailed information of where you're going, the person you're going to meet, so that in contact tracing, that would be very easy to see that Moses entered in this building. He went to see, let's say, he went to see Lydian. He entered this time, he left this time. So it's an easy way to trace that this person had a contact with this person. So I think on contact tracing, it can help if many people are using it. I think that's all I can say. If you can ask me any other question, I can answer. Thank you.
Thank you, Moses. Up next, we're going to have a small presentation of what Moses has been talking about. It's just a 1-minute video. Check it out.
How do you feel when you find a long queue at the entrance? Exactly. In these uncertain times, you don't need a queue at your entrance. Throw away the books and pens and make a safe decision of getting your organization or business ICAZ out. We have ICAZ Plus for those who run big organizations and ICAZ Basic for all bars and restaurants. ICAZ app is smart and safe. ICAZ also has an option for HR employee management that makes your workplace smartly accessible. Yes, you had it right. ICAZ is efficient and privacy of your client's details is assured. Let's do business in a safe and smart way.
Okay. I think with that, we come to the end of Moses' presentation on ICAZ. For those of you like the journalists who have questions to ask, you can send them in the inbox in the conversation box below. Dr. Jaya? Hello? Dr. Jaya, are you there?
Just trying.
So back to COVID-19. Could I ask a few questions? Like your prediction, what's your prediction in the next few months as we continue to fight the pandemic? You, as a person in the field, as a person who's been researching about COVID and writing about it, what's your prediction in the next few months?
Can you hear me?
Yes, we can hear you.
I see. Okay, because because the microphone still had a sort of a line against it. Yeah, my prediction. Well, we are going to see a huge peak in infections in India and globally wherever the lockdowns have been lifted. And that is predicted. It was anticipated because the moment the lockdowns have been lifted, there's a huge increase in the number of people who are moving out. And in my part of the world, we're finding that physical distancing is proving very difficult as people crowd around each other at the fish markets and vegetable shops and in the bazaars and so on. And the masks are not being worn properly. They're, usually they're around your chin, giving 100% protection to the chin. They're not on the nose. So we're not seeing masks being worn properly, and hand washing is an issue when there's a water scarcity in many parts of the big cities. So we anticipate that there's going to be a big hike over the coming few months. So that's how it's going to go, and we'll just have to live with it till it starts to decline again. Some of the states have already called for lockdowns in the hotspot area. So it's now a more strategic calling for lockdowns, and that's how they're going about it. They're either interrupting the lockdowns or they are going for geographical, lockdowns in certain areas that are hotspots.
Thank you so much, Dr. Jaya, for that. We have someone for participant in discussion. She's asking, most of the refugees don't have tools and access to digital tools. And how can they protect themselves against the pandemic? Dr. Jaya, could you
Sure.
tackle that?
I think that even in traditional public health, marginalized populations, whether they are indigenous groups, people living in hard to access areas for the health system, and refugees, people in conflict situations, even in the traditional contact tracing, they were falling between the cracks of the public health system. And the digital tools may not play a huge role because you need electricity to charge your phones. The Indian app works on smartphone and Androids, but who has them unless the government distributes them to these people and ensures. And in a refugee situation, most likely the phones will get stolen or broken, and so you need long-term support for personal technology tools. And we know that that's going to be very, very difficult in these most vulnerable populations. So my short answer is I don't think they're going to benefit from the arrival of digital technology unless we can address these other basic issues.
Thank you so much. Thank you so much, Dr. Jaya. Dr. Mutabazi, are you there?
Yes.
I hope you
can you hear me, Kimenyi?
I can hear you, sir.
Okay, wonderful.
Okay, my question to you is, what do you wish the world would have done differently during this pandemic? And if you were to do it over again, what would you change, sir?
It's 3:15.
Sorry, that was my...
Thank you, Brian. I think the quick and short questions is, what do I feel that would have been done differently would be an earlier response timeline. So I think the things would have been in the parts of the pandemic or the earlier months. But well, this is dependent on how much information on how we understood the virus at that point in time. So from the later parts of 2019 into the early months of the year, it was really a learning curve for public health systems, for governments, and so on all those involved in the response. So over the months, and as we go on and how the epidemic evolves, we have learned quite a bit in the past number of months, and of course, going back, we would have done a number of things differently, but going forward to improve our response to the COVID-19 pandemic and going forward. But what is key is that from these lessons and experience from the work that we have done, we feel that better prepared in dealing with the, but also we are in a better stand of dealing with the future.
Yeah. Christoph, may I ask a question? Oh yeah, there's a question. There's a question in the box.
Yes, please.
There's a question in the box, Christoph.
Yes, doctor.
The question goes to Dr. Mtawazi, I think. It's from Lavi Mutangashuro. The question is, Dr. Mtawazi, do you see the question?
Can you hear me? Yes.
There's a question from...
Can you hear me?
Yes, I can hear you now.
Okay. The question is, where do you still find the digital response gap in Rwanda? So there are other areas that we have already started using digital technology in part of the response.
Sorry, I think there's an internet connection problem with Dr. Mtawazi. If there is any other question or intervention, kindly raise your hand. Anyone can raise their hand just to speak out your question or intervention, or send them in chat box. Or you can also unmute yourself and speak out or express your thoughts. Yes, Jaya. Yes, Dr. Jaya.
No, it's a question to Moses and to Mr. Buchana.
Yes.
So, yeah, there's a question from Mutaganshuro. I'm so sorry. My Indian names are probably just as hard to pronounce, but The question is, as people who provide digital solutions, how are people in Rwanda embracing them? And that's to the Rwandans here. Yeah. For Mr. Moses.
Moses, are you there?
Hello? Yeah, I'm here.
Mutanga Shuro is asking, as people who provide digital solutions, how are people in Rwanda embracing them?
Okay. So according to some of the clients we saw, so many people are happy about the app, but the problem is that even some, they think it will expose their information. So we've been trying to explain to them how we handle the information, because like those who said about the third party, we only control the information. Even if we provide the app to the operators, they don't see anything else. They only register people. They allow them into the building, but there's nothing else they can do. So we provide the permissions to them. So we deny whatever they can access, which is irrelevant to what they have to do. So people are embracing the app, only that we have to keep teaching them on how of course, they talk about privacy issues, but we guarantee 100% that their privacy is not breached. So about how they embrace the app, it's very good that even some government people are using it, so they have tested it. It is efficient. Only that we have to keep teaching people about how to accept the app. Thank you.
Thank you, Moses. Dr. Jaya, I have a question for you here.
Yeah, please. Go ahead.
This one says, as the pandemic seems to be doing rounds in other countries, in most countries.
Yeah.
I think they're talking about the second wave or third, I don't know. How can we combat these misconceptions and to people more?
Yeah, I think your voice is breaking, Christoph, but I think the question is from a journalist who's wanting to sort of report in a way that breaks misconceptions around the pandemic. Am I right? So I think I'll just go ahead and answer it unless I'm answering the wrong question. So I actually had a question myself about this, and it's echoing what this person has asked, which is as journalists, the kind of messages that we need to send out to the public, I think again have to focus on three major things, and that's hand washing, mask wearing, maintaining physical distancing, also disinfecting surfaces and so on, and not stigmatizing people with COVID. So I think these are very important messages to send out. And as for addressing misconceptions, I think there's a lot of fake news and myths being spread on social media. I can speak for India. I'm not sure what it is like in your countries, but in India, there's a lot of peddling of fake cures, say turmeric water, neem leaf paste, wearing holy ash or taking a mud bath, blowing a conch shell. These are some of the bizarre remedies that are being proposed as cures for SARS-CoV-2 infection. We know they don't work. But, if this kind of misinformation is spread across social media platforms, there will always be one gullible group of people who are going to take these seriously and endanger their lives and fall sick. So I think it's important to keep pushing the basic public health messages about physical distancing, hand washing, wearing your masks properly and at all times. I think these are all low-cost, life-saving solutions. We don't need to wait for a high-tech solution like a vaccine, or think about plasma therapy and when to use hydroxychloroquine, all the rest of it. If the public knows about these basic things that it's in their power to follow, I think that's the single most important message we can send out as journalists that will keep saving lives on a daily basis.
Thank you so much, Dr. Jaya. It looks like we're out of time. I'd like to give each panelist a few minutes for their closing remarks. Let me start with you, Mutoni.
I think.
Thank you, Brian. I would like to thank everyone. I would like to thank everyone for attending this webinar. And as my closing remark, I would like to encourage us to use digital tools in sort of an immunization for COVID-19 and all the other tools that Dr. Jaya spoke about. We propose that all establishments would embrace a journey of digitization of Ikaze and other digital tools alongside other trusted our other trusted clients such as NIDA and other telecom houses. And we hope that these can be safely so as not to go back into a lockdown, like in other cases of countries that we've seen going into lockdowns because of mere disregarding the government directives. So thank you very much. Back to you, Brian.
Thank you, Mutoni. Dr. Vincent, please go ahead with your parting words. Dr. Vincent? Looks like we've lost him. Dr. Jaya, please, your parting words.
Am I? Yeah, thank you. I'd just like to thank Christoph. Thank you, Kimeni, for moderating this. And thank you, Christoph, for arranging this wonderful panel. It was a real pleasure to listen to all the other panelists. And it's so exciting that in Africa, you have this exciting new app, Ikazi. And I'm really hoping that you don't face the kind of societal pushback that we faced in India. And I wish you all success because it is a very, very invaluable tool. And it should serve a very valuable public health purpose in helping us to stop the transmission of COVID-19. So I wish everyone all the best, and I thank everyone for this opportunity, particularly Christoph. And thank all the participants for their wonderful questions as well. Really enjoyed being a part of this. Thank you.
Thank you so much, Dr. Jaya. It was a pleasure having you. It was a pleasure being with you all panelists and participated with those who sent their questions. We hope to do this once again. Have a happy weekend.
Thank you. Thank you.
Thank you.